Hi everyone, it's your favorite girl again, and welcome to this page once again. Today I'll just be talking about some diseases of the respiratory system. I'm here with four types of diseases of the respiratory system. I'm here with tuberculosis, pneumonia, bronchitis, and asthma. I'll just be talking about one today. Follow my page for more. The one I'll be talking about today is tuberculosis. What is tuberculosis? Tuberculosis is type of respiratory system diseases that can be transmitted from one person to another through a microscopic droplet into the air. Now moving to types of tuberculosis. There are four types of tuberculosis. We have pulmonary tuberculosis, extrapulmonary tuberculosis, latent tuberculosis, and multi-drug resistance tuberculosis. I will explain them one by one. What is pulmonary tuberculosis? Pulmonary tuberculosis is a contagious lung infection caused by the bacteria caused by the bacterium tuberculosis. It can spread through the air when an infected person sneezes or cough. Another one is extrapulmonary tuberculosis. Extrapulmonary tuberculosis is a bacterial infection that affects organs outside the lungs. They affect organs outside the lungs. Another one is latent tuberculosis. Latent tuberculosis is when a person that is infected with Mycobacterium tuberculosis but does not have active tuberculosis. Note this, that active tuberculosis can be contagious while latent tuberculosis cannot be contagious. The last one is multi-drug resistance tuberculosis is a type of tuberculosis that is resistant to at least two of the most effective first line tuberculosis drug such as isoniazid and rifampicin. Now I'm moving to causes of tuberculosis. What are the causes of tuberculosis? Tuberculosis is caused by bacteria known as Mycobacterium tuberculosis, and tuberculosis can also be caused by air pollution. Air pollution, it can be industrial pollution or smoke. Note that any type of smoke can cause tuberculosis. What are the signs and symptoms of tuberculosis? The first one is chest pain, general weakness, persistent coughing that is more than 3 weeks, night sweats, phlegm with blood stain, phlegm with blood stain. So prevention of tuberculosis. What are the preventions of tuberculosis? The first one is good hygiene. Good hygiene can prevent someone from having tuberculosis. That is washing hands regularly, covering the nose and mouth when coughing or sneezing. Another one is good ventilation. Good ventilation can also prevent someone from having tuberculosis. Another one is vaccination, getting vaccination. And the vaccine for tuberculosis is BCG. BCG, Bacilli Calmette Guarin. Bacilli Calmette Guarin. Another one is natural light. Natural light, that is ultraviolet light kills of the TB bacteria. Ultraviolet light kills of the TB bacteria. What are the tests that you need to undergo before you can conclude that this so person is having tuberculosis? Number one is chest X-ray. Number two is gene expert ex- gene expert test, and the last one is sputum test. Management of tuberculosis. But before I move to the management of tuberculosis, note that tuberculosis mainly affects the lungs. It mainly affects the lungs, though it affects some organs outside the lungs too, but it mainly affects the lungs. Management of tuberculosis. What are the things you can use to manage tuberculosis or to cure tuberculosis? Number one is combination of rifampicin, isoniazid, pyrazinamide together for at least 4 months. The person should use it for at least 4 months. Then give the person isoniazid and rifampicin for at least 2 months. For at least 2 months. Cough syrup should be given to the person as well, and antibiotics should be given to the person as well. Such antibiotics can be erythromycin, crystalline penicillin, Septrin, aminophylline, etc. Note that one of these should be given to the person for at least 2 weeks. It should be given to the person for at least 2 weeks. Thank you everyone for watching. Like, share, and comment. Note this, that stay healthy and your health is my concern. Your health is my concern. I love you all.